Chris Holly's calm acceptance of the inevitable, basically, is deeply moving, isn't it? He's brave, he's upbeat, he's absolutely taking it on the chin.
Yeah. Well, what an extraordinary interview yesterday. His bravery is immense. And reading his interview, I just really felt for his children as well, and how he told his children. And I've got 2 children, I've got 2 girls. I cannot imagine sitting down for dinner with them and having to go through this conversation. And then when they ask, Daddy, does this mean you're going to die? I mean, that is, for me, is just... it just fills me with so much emotion to read that and to think about how I would ever have to have that conversation with my own kids.
Because you think your dad's going to die forever. Sorry, he's going to live forever.
Yeah,
he's a hero. But, I mean, their dad is Chris Hoy. He's won 6 gold medals and 11 world championships, figure of fit, a role model around the world. It shouldn't happen to people like him, should it?
Well, and yes, he makes the point, of course, that I didn't realise this, but screening for prostate cancer doesn't happen for men on the NHS until they are 50. His grandfather had prostate cancer, his father had prostate cancer, but because he was under 50, he didn't get the screening. Now, as you say, Andrew, that it shouldn't happen, and presumably if he'd had some form of screening, perhaps it could have been stopped in its tracks before it got to his bones. Jonathan, you were Shadow Health Secretary.
Yeah.
What is the reason, other than cost, presumably, that this screening, which is where you get your PSA tested and high levels of this PSA mean that you might be at risk of prostate cancer, what's the reason for not making that age threshold lower? Well,
it'll be a statistical reason. But there are different screenings in healthcare which kick in at different stages in your life. And what will happen is clinicians look at this very carefully, and they will have made a judgment that from 50 onwards, you are more likely to be at risk of this particular cancer. Therefore, that's the age at which that screening would kick in. But of course, that's just a statistical analysis. It does mean, unfortunately, there are people who are on the wrong side of that cut-off.
And the test isn't actually definite, is it? Because it can simply show you have an enlarged prostate, and that is not necessarily anything to do with cancer. Yeah.
So like there'll be loads of sort of medical experts who actually argue about this stuff all the time. They argue about things called false positives. They argue about people who they call them the worried well, who then sometimes take medical action when they weren't necessarily going to go on to develop cancers. I think, for example, is it Angelina Jolie who took some had some treatment because she thought she considered herself to be at risk of a particular cancer?
Yeah, because it was, I think it affected her mother.
Right.
Yeah.
Well, I mean, I suppose that this is all about, as we're talking about the 10-year plan for the NHS, this is all about what we can all do to prevent illness.
But on that Chris Hoy thing, what was also heartbreaking to read was the revelation about the aggressive form of MS his wife is suffering.
Yes.
My God, what a terrible double whammy for that family.
Yeah.
And yet they're both taking such a kind of courageous, positive view of both of those things. They both consider themselves lucky, they've said, that they are, at least they have something which is, if not curable, is treatable. And I must say that I thought this particular quote, I've just got it here, from Sir Chris, it really touched me. He says, as unnatural as this feels, he's talking about himself here, this is nature, he says. We're all born, we all die, this is just part of the process. You remind yourself, aren't I lucky that there is medicine I can take that will fend this off for as long as possible?
And I'm sure, and I think frame of mind, if you talk to psychologists, will say, can help fight that disease if you have a good, strong, positive outlook, which he clearly has on life in general.
Yeah. So, Jonathan, what should we do to protect ourselves? Screening might be one thing. Wearable tech, Wes Streeting suggesting, might be another thing that we can all do to make sure that we stay as healthy as possible. Is that a realistic option? Is that something that the NHS is going to fund? Are we all going to be wearing Fitbits and Whoop bracelets?
Well, Wes Streeting today is talking about that, isn't it? And he's also saying that the NHS app, which you can all download, should be able to contain all your medical evidence. I mean, it's always struck me, I wear a Fitbit, and I obviously have the Fitbit app on my phone, sorry if I'm doing any advertising there. But anyway, we all wear, you know, I have one of those wearables.
Smartwatches are available.
All the smartwatches are available. And I often do wonder, why is all that data available on that app and it's not available on my NHS app? Is there a way of linking the two together?
There must be.
Yeah, there has to be, surely. Look, we know that we have got more and more people who are putting on weight because they're eating badly or drinking too much. We know that smoking remains an issue, even though this country's made amazing progress on smoking. We know that we are generally unhealthy as a society. That puts pressure on the NHS, and it means in some circumstances people are dying much sooner in life than they otherwise would. So we do all need to try and live a healthier lifestyle, but in the end, the NHS needs to be there for people as well. So you've got to reform the NHS, and you've got to increase access to the NHS, I would argue.
Well, the other person in the headlines this weekend because of her health was, of course, Jeremy Clarkson, who it emerges was possibly within 3 or 4 days of dying, according to his consultant, because he had completely undiagnosed blockages of a main artery to the heart. And the first he knew about it was just a couple of weeks ago when he was on holiday, and he just felt generally ill. Couldn't get his breath properly, found he couldn't swim properly in the pool, came home, felt even worse, went to the hospital thinking, well, it could be anything. Turned out that he was very, very close to his heart stopping.
Yeah. And he would, the piece admits, he's not in great shape.
And he used to smoke like a chimney.
Yeah, and if you see Clarkson, he carries quite a paunch at the front. Yeah. And we men know, we get told again and again, you can't have that paunch because that's where the problems can start.
The thing is, we're all of us told all of the things that we should do in order to keep ourselves fit and well. But the health of the nation has deteriorated over the past 15 years. I find that kind of extraordinary. We're in an age of huge amounts of information. Everybody knows what they should be doing to keep fit and well. But there's a sort of sometimes an attitude of, but I want to live a good life while I've got it, so I don't want to just eat kale and celery.
Yeah.
Until the point where you realise that actually you have to change your lifestyle. But then plenty of people get in touch to say, well, my granddad lived until he was 99, smoked like a chimney and had a glass of water.
Do we do enough exercise and do we eat too much rubbish food, processed food?
I don't do enough exercise and I eat too much processed food, definitely.
Yeah. And are these factors? I mean, that's part of the obesity problem, and obesity is now the biggest problem for the NHS.
So how much is on us and how much is on the government, and how much is that nanny state? We know that when the smoking ban came in, it had a massive effect on people's health. So should there be a processed food ban brought in?
Well, I don't think you can ban processed food, but look, one of the things that the last Conservative government did...
Why not? Just explain why you think that wouldn't work.
Because I just think processed food is such a big part of the...
it's cheap.
The food economy.
It's cheap.
It is cheap.
And that's what households can afford.
I mean, yeah, I mean, it is cheap, and that is an issue this food is cheaper than fresh fruit and vegetables or cooking from scratch for so often.
Did George Osborne bring in a sugar tax?
I was going to talk about the sugar tax the last Conservative government brought in. That has been successful in forcing drink manufacturers, you know, who make the fizzy drinks, to change the contents of their drink, to reduce the sugar in their contents. And there has been some evidence that childhood obesity, we've always been terrible in this country at childhood obesity, is beginning to... we're beginning to turn a corner from a very high level of childhood obesity compared to some
Well, that's one piece of good news. But as you say, Susanna, it is weird, isn't it, that the more we know and the more we understand and we can put into layman's terms what the health threats that we all face are and how we can swerve them, actually, the more poorly we're getting. It is extraordinary.
Well, also, and that's why Wes Streeting's big idea yesterday, my heart sank. He's launching a national consultation listening exercise.
Well,
Have
we're
we not
part
heard
of it
that
now.
before?
This is, I feel like we're contributing in this conversation.
How long have they had in opposition? Has he not been talking to people? Has he not been talking to the right people? Has the Labour front... Was Jonathan Ashworth, when he was Shadow Health Secretary, not talking to people? No, I thought he would have an action plan ready to go, not have to wait another 6 months, or is it going to take 9 months? If the crisis is as grave as they say, why do we need another headline-grabbing talking shop?
Yeah,
because when they do announce radical proposals, people like Andrew come out and complain about them. Like, for example, when Wes Streeting was floating the idea of banning smoking in pub gardens, for example, I bet you were on this show complaining about that. Yeah, well, this is the point. He wants to have a consultation. He wants to have
I
views.
do not smoke in pub gardens.
Right, so, and we know that smoking is bad for you, and we know that when we banned smoking indoors, it led to a dramatic increase in the quality of our health. So why wouldn't you be in favour of smoking in pub gardens?
Because I completely understand the ban in public places, restaurants, cinemas, theatres.
You mean enclosed places?
Transformative.
Yeah.
I don't think having a fag in a pub garden is going to impact on people sitting on the table 4 yards away from you.
No, but it can impact, and I speak as an ex-smoker, it impacts you if you're sitting next to the person. You know, if you're sitting...
Well, then, if we want to do that, I mean, let's go the whole hog then and ban them.
Right, Jonathan, what about that? What impact would that have on the NHS if we simply banned smoking?
Well, it would have a huge impact on the NHS. It certainly would. I mean, I've never been a smoker. Never ever been a smoker. I've always hated it actually, but I wouldn't go as far as banning it completely. No way, because look, you know, you've got to in society find a balance. But that's why it's a good idea.
So Andrew's
that's why it's a good idea to consult the people and ask them what they want.
Andrew's balance is you can't smoke indoors, but you can smoke outdoors.
And if they consult about banning fags in the garden, they're still going to ban them in the garden, let me tell you.
But smoking's dying out anyway, isn't it? I mean, most young people don't smoke.
But worryingly, they vape now, Richard, and the whole point about vapes was
There are issues with vaping.
Yeah, we thought vapes was to get smokers off of fags, but now we know how many young people are being brought into vaping who would probably never have smoked in the first place.
But that's because they're all marketed with all these sort of, you know, bubblegum flavour.
I agree, terrible.
You know, raspberry ripple flavour. They do look like sweet shops. I mean, there was one in the constituency I used to represent. There was one which used to have that sort of kind of cartoon characters in the window, and then we wonder why kids are moving on to these things.
What would you say if you knew that if you didn't turn up to an appointment, you'd be charged, let's say, a £10 flat fee for missing your hospital appointment or your GP appointment? Is that... Wes Streeting hasn't ruled it out.
I bet he does.
It's on the front of the Telegraph this morning. They may face
This
fines.
has been banging around for years, this idea.
Rishi Sunak raised it in the last couple of years and then dropped it.
There could be a very good reason why you miss it.
Your taxi doesn't turn up.
Yeah, or you're too sick to get there. But there are people we know are repeat offenders. Repeat offenders have to be fined.
8 million hospital appointments are missed each year, about 1 in 15, as well as around 1 million GP slots, and it costs more than £1 billion a year. I looked at the Daily Telegraph's poll on this, and 80% of people said yes, fine people for missing an appointment. The trouble is, it's very easy to point the finger, isn't it, and say they should be fined. But of course, as you say, sometimes hospital transport that's been booked doesn't turn up. And then what do you do? Sometimes you've got a childcare issue, and then what do you do?
But people get angry about cancelled GP appointments in particular because getting a GP appointment is like seeing a blue moon.
Yeah, you'd have to get a GP appointment in the first place before you get it.
What about people living on the breadline who miss the appointment in all good faith? I mean, and can't afford to pay a fine.
That's why it's very difficult. I mean, and I don't think it'll happen. And I bet it won't happen.
I tell you, it won't happen.
No.
And the reason it won't happen is because of two fundamental things. First of all, the NHS is supposed to be free, and people will argue that this is the opening and the slippery slope to more charges in the NHS. But secondly, the bureaucracy involved in chasing this down is immense. Yeah. And the NHS will end up spending more money trying to chase people...
the fines,
trying to chase the fines, and in the end, they'll make the judgment. It's not worth it.
Can I jump in about the free NHS being free at the point? It isn't anymore, is it? Let's be honest. Tell that somebody who wants to get a checkup at the dentist. How is that going to cost?
Well, dentistry is a kind
it's a key part of the NHS. A key part of the NHS.
But you don't want GP surgeries to go down the road of dentistry.
No, I'm not saying, but I'm just saying it's becoming a fallacy that the NHS is free.
The elephant in the room in this whole discussion about the consultation is the staff shortages at the NHS. 125,000 vacancies in the NHS at the last time of counting. Loads of doctors going to Australia and other countries because they're fed up with working here. That's the problem that's got to be addressed before we do anything.
Why have we got such a problem? Is it because we can't recruit? Is it because we're not paying people enough? Or is it because people work in an NHS which feels broken, so they leave?
Well, I think it's mostly the latter, because there has been a pay rise now for NHS staff. It's one of the things the Labour government did. I know you'll probably disagree with it, but they have done that.
Just the timing.
So there's been a pay rise. But it has been the ongoing pressures in the NHS But numbers of staff have been going up, right? And they have been asked to do more and more with less and less. But the question is, can they get more out for what they're put in? That's what the economists call productivity. Productivity in the NHS does need to improve. And if as we've seen, as the hints and nudges and winks seem to suggest, we're going to see more money for the NHS in the budget in a couple of weeks' time, I think it will come hand in hand with a big drive to push up productivity in the NHS. Reform the NHS so you get more for every penny you spend.
How many times have we heard about reforming the NHS?
Because we are going to get a bump of pay rise for the NHS in the budget. It will be at the expense of other departments, so it won't be jam all round, and it will be coupled with reform. Where's the money going to be targeted? How do we know it's going to improve patient care? And what is this fabled word reform? What does it mean?
Jonathan, I want to ask, when Lord Archer was in, he had a suggestion. So I'm gathering suggestions from all over the place. He said, why don't you get people who can pay? So not talking about finding people who, for whatever reason, miss their appointments, but the people who can pay, like Lord Archer, like probably most of us sitting here at the desk, pay for their appointments, and that money goes into the NHS rather than people who pay the private system for medical care, and that money not going into the NHS.
Because we have a universal, free at the point of use National Health Service, and that is
apart from dentistry.
That is apart from dentistry, but that was always a slightly separate element
Contract,
anyway.
Yeah.
You know, so we've always had that. That is from the founding of the National Health Service, and I think if you go down the road of asking richer people to pay more, there is, in my view, a theory, or it's always proven to be the case, that if you allow richer people just to pay, they will get the better services at the expense of everybody else.
Why not just have those people who can pay get the same service, but the money that they use goes in and improves the service for everybody?
Well, there's nothing to stop them making a voluntary contribution to the NHS.
Well, where would that end up?
A
black hole.
Yeah.
A black hole.
Well, I expect a lot of people do contribute
And how would you...
to their local services, perhaps through charities.
And how would you judge who should pay? Because the thing is this, everybody knows that Richard Branson and billionaires, you know, think they are rich. But actually, when you start drawing the line on these
top
things...
rate of tax?
Income tax.
Top rate of tax?
A lot of people who are paying those levels of tax, right, they would not consider themselves rich. They are rich, by the way. They are rich. Don't get me wrong, they are rich. But you end up getting people who start complaining and saying they're not rich. Why should they have to pay?
That sounds a bit like
See, this is the listening to the NHS. They've listened. They've decided.
No.
These are basic things that could be changed, and they've decided already.
Now, look, can we talk about something else? We've had a number of awful incidents quite recently of young people driving their cars. They've only recently qualified, only been driving for the last few months, and they've been involved in fatal crashes. Very often, when the car's been full of their mates, we're going to be talking to the mother of one of those. I almost say children because they're so young, a bit later in the programme, who's very, very much in favour of what's been described as the graduate driving licence, where basically, when you qualify, when you're young, let's say you're 21, you don't have the full rights that the rest of drivers have. For example, you can't carry people your own age around, maybe for the first 6 months. You get used to what it's like to drive because you're so new at driving that the distractions of having your mates in the car might actually lead to tragedy. What do you think about something like that?
Well, you'll have seen statistics more in your job, but I think it sounds very sensible because a young man, in particular, behind the wheel of a car is potentially lethal, more dangerous than a young man with a gun because of the damage it can cause if the car loses control, that they like speed. And I think, at least in the car on their own, and I don't see why all drivers, actually, when they pass a test, don't all have to have a probationary period.
Department of Transport figures
on the car
show that 290 people were killed and almost 5,000 seriously injured in crashes on Britain's roads last year, involving a driver aged 17 to 24.
Terrible. Terrible figure. That's a terrible
So the AA is suggesting new drivers aged under 21 should not be allowed to carry passengers of a similar age, aged up to 21, and it would be for 6 months after passing their test. Now, of course, that sounds like a sensible idea, and as you say, we're going to speak to the mum of Harvey Owen, who died in this awful crash which happened last year in November. 4 lads, you know, off on an adventure in Wales, came off the road.
The one that went into the river.
And they were submerged in water. Absolutely horrific and awful. And she is putting her sort of heart and soul into campaigning for this, and you can totally understand why. But there would have to be exemptions because, of course, young parents need to be able to travel with their children. And young carers might need to travel with, I don't know, somebody that they're looking after. So there would have to be careful exemptions. But it is in operation, this kind of scheme in New Zealand, in Australia. I mean...
It's also being suggested that young people should have to have at least 6 months training before they take their tests. At the moment, you can go on one of these express courses and you can take your test just a few weeks after learning to drive. They're suggesting that you should actually have 6 months of lessons before you take your test.
Yeah, and I don't think, I mean, unless it's changed since I was driving, do they get trained on the, get any lessons on the motorway?
No, that's a separate training course.
Appalling.
Yeah.
I mean, you think how fast cars go on the motorway.
Yeah.
I mean, I wasn't aware that this type of scheme was in place in Australia and New Zealand. It sounds to me eminently sensible. I suspect it would be difficult to enforce, and as you say, there'd have to be sensible exemptions. But nonetheless, this does seem to be the sort of thing that the government should be looking at and considering. And it's one of the things that I will go and badger government ministers about as well.
As I say, we'll be talking to the mother of one of these tragic stories, young lad, a bit later. Kemi Badenoch is very good at stirring up rows, isn't she? I mean, she really is good at stirring the pot. And she's been talking over the weekend about 2 parents being better than 1. Simple as that. Where are the missing dads? We've got to chase the missing dads and get them to take their responsibilities because 2 is better than 1. A lot of single parents are very annoyed by that and saying, I run an extremely tight ship on my own, it's fine, I don't need the father around. What do you think?
Well, I mean, it does slightly feel like the typical Tories of old bashing lone parent families again. I mean, this is something the Tories always used to do when I was growing up, I remember it.
Kemi Badenoch, sorry, just to point out, if you don't know, Kemi Badenoch is one of the final 2 who might be the Tory leader. She's actually said this is not what she's doing. She said that previously she thinks that the Tories have focused too much, particularly on single mums. Her point is, don't stigmatise single mums. Ask, where are the dads?
Yeah.
And I'm not sure that that's a bad question to ask. It's not saying you need to be married and you need to have a traditional family setup. She's just saying, why is all the focus always on single mums and not dads? Play your part?
Well, I mean, that is not a bad question, but, I mean, I do think you've got to be careful in this debate. I mean, my mum and dad were divorced, you know, and I lived with my mum for some of the week, and then I'd go and stay with my dad in other bits of the week.
Oh, so your dad was still part of your life?
It's still part of my life, but, you know, parents... You know, families are very complicated and very complex. And, of course, it's very legitimate to ask, you know, do dads who run off and never contribute to the upbringing of their children and refuse to engage with the child maintenance service? And actually, when you look at the child maintenance statistics, there are a lot of dads who are just not paying, and the child maintenance service needs to get better at getting that money out of them for the kids. That's most certainly true, and it needs to be reformed. It's not really been looked at for about sort of 15, 20 years, the child maintenance service.
There's a very interesting statistic that's also come out as part of this. The vast majority of male prisoners in this country had no present father. They grew up without a father in their lives.
And I think you'll find quite often some of these young men who get lured into gangs in our inner cities...
They're looking for a father substitute.
Looking for a father substitute. And what Jonathan said about child maintenance is interesting. I saw a former pensions minister the other week, and they said the number of men who do absent dads who do not cough up their proper share is scandalous and growing all the time. And some of them have the money, they just won't pay.
It's not just the money, though, is it? It's providing a role model.
Yeah, it is. And I don't think... I'm not a parent, but I could think as well, of course single parents do a great job, but sometimes it's going to be a bit easier if there's a dad there too.
Right, we are debating that after 8 o'clock this morning.
Or a single dad, it helps if there's a mum there too.
We appreciate that,
He said for
that
quickly.
families are... yeah.